as of October. So we're very blessed today to mighty welcome the Administration for Community Living. I've been working with Lori Gerhardt, the director of the Office of the Innovations of the U.S. Administration of Community Living for a long time, and she's one of my favorite people. So we've been working together for a very long time, and this week we got to meet Alicia Anderson from the housing team, and I was just so impressed with all of her knowledge about housing and services and resources. And as we start to bridge into this working with the entire person and working around all this social determinants of health, the issue of housing keeps repeating itself. So we thought it would be a great idea to invite Lori and Alicia to speak to you today about housing and what's going on at the federal level. So thank you so very much, Lori and Alicia. I'm going to turn this presentation over to you now.
Well, thank you so much, Leanne. And you're one of my favorite people too. We've been able to do a lot together, and it really helps to have the connection with people that are working in communities to really serve older adults and people with disabilities and caregivers. That boots on the ground view is so helpful to us to best know how to support you all. And we're hoping today we can learn a lot from you on what your particular needs are and what you're seeing. So if we go on to the next slide. And we go on to the next slide. So today we're going to just quickly do some introductions. We're pleased to be with you today. We're coming to you from in the context of the Housing and Services Resource Center. And the Housing and Services Resource Center is a partnership between HUD and HHS, and it includes HUD, the Administration for Community Living, the Assistant Secretary for Planning and Evaluation at HHS, the Centers for Disease Control and Prevention, the Center for Medicare and Medicaid Services, the Substance Abuse and Mental Health Services Administration. And we've been working together on how we can leverage our collective technical assistance to support communities and states as you all are working to serve older adults, people with disabilities, and help them obtain and maintain stable housing. So we're coming to you in that context. We want to learn some things from you today, and then we'll pull in our other partners to really help support you in the work that you're doing and the needs that you might have as we learn more about those things today. So we're going to do a quick introduction. Then we're going to talk a little bit about the housing needs of the Maryland Living Well Center of Excellence network. We really want to hear what's important to you and what your needs might be. And then also share a little bit about partnerships and opportunities and some resources. This is the first network lead entity that we're meeting with to talk about housing. So this is really exciting for us. And we really welcome not only your feedback and your input on what your needs might be, but also your feedback and input on how this style of a learning opportunity is working or not, and what suggestions you might have on how we can continue to grow and enhance it. So if we move on to the next slide. So we would like to use Menti today to get some input from you. And if you aren't able to use Menti, if you go ahead and use the chat, that will work great. So Alicia just put in the chat the link to the Menti site. And so you can go to Menti either on your laptop or computer in your browser, or you can also access it on your browser on your phone. And if you go to the Menti site, and then if you enter the code 4918-0273, where it prompts you when you go onto the site, it'll say enter a code to participate in a meeting. And when you enter that code or push join a presentation, a question should come up that says, what is the name of your organization? If you could type in the name of your organization, we're going to give this a test and see how it goes. And if people just work on that question right now, I'm going to give you a couple minutes to get Menti set up. And Kate Russell is helping us today from Mission Analytics. And Mission Analytics has the contract on the Housing and Services Resource Center and also supports the network lead entity. So we're pleased to have Kate with us today and helping us. And Kate, if you can maybe give me a signal when we're starting to see some responses come in on the name of the organizations.
Sure, yes, we see a few responses so far. Looks like 4 responses. Would you like me to go ahead and share the results or give folks a few more minutes?
Yeah, I think, let's see here. Maybe we'll just give people another minute to get this set up. Are the responses still coming in, Kate?
They are. It looks like we have 6 responses so far.
Great. It takes a little bit to get into Menti, but once you're there, this will go pretty smooth. And for those of you that have already entered that information, you can start thinking about what are your organization's most challenging housing related service needs. That's going to be the next question. Kate, are we still getting responses?
It slowed down a bit, but we have 9, oh, still trickling in.
Okay.
But if you'd like, I can go ahead and share my screen and
Yeah, why don't you go ahead and do that so we can get
Okay.
a sense of who's here. Okay, great. Looks like we have people from Maryland Department of Aging, some folks from MAC, the Baltimore County Department of Aging, Washington County Commission on Aging, Calvert County Health Department, McFarland and Associates. That's great. Okay, Kate, I'm going to ask you if we can move on to the next question. So the next question is, what are your organization's most challenging housing related needs? And you should be able to push to go to the next question on your Menti screen. And you can enter as many answers as you would like to this question. So we're starting to get some responses: connection to resources, understanding what is available, lack of direct housing assistance options, knowing who to call. That's an important one. Connecting to resources that are affordable to clients, lack of housing, rent assistance, long waiting lists for subsidized housing, affordability, wait times. These are all really issues that we're hearing: affordable housing, lack of housing. I have some good news that I think some of these we can help you with. And some of them will have to be working together. And it looks like we're getting some really good responses. The page is filling up. Employee turnovers, that's a new one there. Lack of housing, not a new issue, but a new one to our list that we have in front of us. Lack of housing for those with mobility issues. Yeah, we've been hearing that. Not enough housing options, long wait lists, and affordability. Well, I want to thank everybody for this input, and we're going to go ahead and go back to the presentation. We can maybe leave this open a little bit longer that you can continue to enter any of your last minute thoughts. And this doesn't have to be an exhaustive list. We can come back to it. But if we can switch back to the presentation, you know, you mentioned some of these issues, so they're very familiar to you. We know that more than 800,000 people are on state Medicaid waiting lists. And when people are waiting for like home and community-based services and things, or the supports that they might need, sometimes that results in unnecessary institutionalization. We also know that some people are living at home, but then they need supports and they can't get those supports, or they don't know where to go to get them. And so there's, they don't get the supports they need, then they end up in an institution, or they can become homeless. And about 50% of the HUD properties for older adults lack a service coordinator. And we know how critical service coordinators are, particularly in the disability and aging networks, but even in the HUD funded housing programs, the service coordinators can really help people get connected to the services or find the services that help them stay stably housed. We know that affordable and accessible housing stock is a challenge, that there for 48% of extremely low income renter households are seniors, and 18% and 30% of people with disabilities are also, or 18% of people with disabilities are in renter households. For every 100 extremely low income renter households, there are only 40 affordable and available homes. And we know accessibility is a huge issue. Fewer than 5% of housing units are accessible for people with moderate or mobility difficulties. And less than 1% are actually accessible to people who use a wheelchair full time. And this is one of the greatest ahas that I've had over the last year as we started working on housing, is that each year nearly 900,000 people fall into homelessness. That means these are people who had a home that all of a sudden become homeless. And we know there's a lot of reasons why people lose their home. And so this is an area where we also want to concentrate, that as we're trying to, as we're serving people who are at home, we want to find ways to help them stay in their homes and keep their homes. And then we also want to be serving people who have become homeless and are seeking to get and obtain stable housing. If we go on to the next slide. So we'd like to learn a little bit about the populations that you're serving, and you can check all that apply. This is another Menti poll. So if you go back to your screen, these are some of the options: people transitioning out of institutions, people who are experiencing homelessness, people who are currently housed but at risk of losing their housing, people who need affordable housing, people who need accessible housing, older adults over age 60, people with disabilities, and there's another category for those that we might not cover on the list that we have. And for people who are joining us, we'll put in the chat again the link to the Menti website. If you go to that site and you enter the code 49180273, if you're not already there, you can use your browser on your laptop, or you can use your phone, your browser on your phone. And if you can join in and share your responses to what populations are you serving. And it looks like we're getting some responses here. Oh, people's answers are coming in. So definitely people who need affordable housing. There's a large concentration there. Followed closely by people who need accessible housing. Looks like we're serving both older adults and people with disabilities across the group collectively. And then people who are currently housed but are at risk of losing their housing comes in at number 3 maybe, and then people transitioning out of institutions, and then people who are experiencing homelessness. We've got some more responses coming in. This is really helpful. It looks like affordable housing continues to lead the way, but it's closely followed by the other areas. So if we can move on to the next slide. So we wanted to reference the Building Connective Tissue for Effective Housing Health Initiatives paper that was published by the Brookings Institute and authored by Marcella McGuire and Stuart Butler. And this document is really important to our health and housing partnerships. And so if you haven't read it, there is a link in the PowerPoint slide deck. We encourage you to take a look at it. And basically what they say in the article is that housing and health sectors are natural partners to tackle a range of issues, including ending homelessness, helping older adults age in place, and improving health in under-resourced communities. If we go on to the next slide. And we know that when we work together to align and leverage our work to coordinate affordable, accessible housing with increased access to health and home and community-based services, we create the infrastructure to fully meet the needs of the people we serve. And this is all possible by partnerships, right? But we know that partnerships don't just happen. We really need to have some connective tissue or infrastructure that supports the frequent and systemic level collaborations to really help form the partnerships and hold it together over time. And so the network lead entities, community hubs, opportunities to really bring the health and housing, disability, aging sectors together are really critical in how we continue to grow our relationships as partners, because ultimately we're serving the same people and we all have different levels of expertise, resources that we're bringing to the table. And so one of the roles of the Housing and Services Resource Center is to facilitate greater partnerships at the federal level to leverage our technical assistance resources, and then also in our investments and coordinate our programs a little more and look at our policy issues a little more collectively. We're also looking at how we can support both the states and the community, disability, aging, health, and housing sectors to really come together and move some of the barriers out of the way that might be prohibiting any of that to occur. So if we go on to the next slide. So Alicia and I did a little homework as we prepared for this presentation, and Leanne and her team also helped to prep us a little bit. So we wanted to identify a couple of opportunities within Maryland that sort of fit in the context of what we're looking at nationally too. So under the Money Follows the Persons program, for the first time ever, through that demonstration, CMS has a supplemental services option where states with MFP programs under this demonstration can develop and submit a housing plan that, once approved, will enable them to provide some of the housing wraparound supports that really help a person get access to housing. Very similar to the Money Follows the Person Bridge Subsidy Program that you all have in Maryland. And so across the country, we're working through the Centers for Medicare and Medicaid Services Money Follows the Person program. We're working with states and to try to help support how we can bring together or use supplemental services under the Money Follows the Persons demonstration. And these can be things like first month's rent, security deposits, helping to identify or provide furniture to help get apartments or homes furnished so that people can move into them, satisfying prior debt on utilities so people can set up a utility account. Each state, though, will determine what will be in their supplemental services benefit, and that's where the housing plan comes in. So we did want to highlight a couple of initiatives too that you have at play in Maryland. And Alicia, I'm going to just ask if you want to talk a little bit about the HUD 811 Project Rental Assistance Program. Alicia has lots of expertise in housing and comes from HUD and joined ACL a few years ago. And so we're really pleased to have her on the team. Alicia, do you want to talk about the HUD 811 Project Rental Assistance?
Sure, Lori. 811 Project Rental Assistant came out of Melville. I believe that was in about 2010. And what it did was it took out the capital events, which was the money to build the housing, and it simply limited it to the rental assistance. The great thing with that is that it really brought forward the whole integration approach, that people could take this rental assistance and live wherever they wanted to, rather than just limited to the developments that had been constructed. I recall, and it's been some years, so forgive me, but I do have a strong presence of Maryland and the impact that they had made within this program. And I believe that there may be some webinars on HUD archives, you know, with Maryland sharing what they did in this space. What's so powerful with this program is that legislatively, it brought to bear the need for partnerships between health and between housing, and the ability to work together to cause impact in this space. And Maryland did make a difference. And what I do want to share, just coming here to ACL, what I do see was a miss for, you know, looking at this program at a larger scale, was that we didn't focus as much on the local infrastructure as we should have to expand and strengthen these partnerships. So being here at ACL and seeing the opportunities that can be made available with this expanded partnership is just such a real contribution to what is possible in this space.
Thanks, Alicia. And so the HUD 811 project rental assistance enables people with low incomes to pay 30% of their income for rent. And then the rest of the rent is actually paid to the landlord, this remaining 70% through the Section 811 project rental assistance program. So it's a way for people with low incomes to obtain housing. And then you all also are blessed to have the Weinberg Foundation, the Harry and Jeanette Weinberg Foundation's Affordable Rental Housing Opportunity Initiative for persons with disabilities. And this initiative is the result of a partnership between the Harry and Jeanette Weinberg Foundation and the state of Maryland to provide affordable rental housing options for persons with disabilities. It's designed to build upon the strengths of the foundation and the state's low-income housing tax credit program, and it seeks to increase accessible, affordable, and independent housing opportunities in the community. Weinberg funded units are referred to as Weinberg Apartments. They house non-elderly disabled people at 10 to 30% of area gross median income. And the eligibility criteria include the ability of a tenant to pay 30% of their income for rent and utilities. The Maryland Department of Health and the Maryland Department of Disabilities are partners in the initiative, and the Maryland Department of Disabilities qualifies eligible households and refers potential tenants to property managers. And the state agencies are all working together to ensure the units remain occupied. As of February 2020, there were 27 Weinberg apartments built and occupied or leased in Dorchester, Hartford, Montgomery, Prince George's, Somerset, and I can't say this one, Wicomico, WICO counties. And there were additional 6 units that were under construction or in the pipeline at that time. And those were in Anne Arundel, Baltimore, and Howard counties, and Baltimore City. So that's another program. And if anyone's using the Weinberg or has worked with the Weinberg Apartments, if you can put that in the chat, that would be helpful for us to have some insight to, because we might want to talk with you a little bit more to understand how that's working and how you're getting connected to it, just so we have some insight on that. And then we mentioned the Maryland Money Follows a Person Bridge Subsidy Program, and that provides a state-funded subsidy for up to 3 years to eligible individuals. And these participants transition to a housing choice voucher or Section 8 voucher or public housing at the end of the MFP bridge subsidy term. And I got to congratulate you all, because you're an example for the country. I think you helped influence some of the supplemental services work that has occurred. So congratulations on that. And then we also wanted to highlight the Community Choice Homes program. This is only available in Montgomery County, but it provides affordable rental homes in Montgomery County. And it provides, let me see here, 30 owned rental units for people with disabilities for a period of 15 years. And so just wanted to highlight that. Now, we want to talk a little bit about housing vouchers, but before we go on to housing vouchers, I just wanted to check in to see if anyone might have any questions. And if you do, if you can raise your hand or put it in the chat. Okay, I'm not seeing anything come in, so we'll keep rolling along. So what's important to know about the emergency housing vouchers, and these on the PowerPoint slide, there's a hyperlink that will take you to the emergency housing voucher dashboard. This is a tool available through HUD, and it really gives up-to-date information for the country, by state, and by public housing authority on the status of emergency housing vouchers. And there were 70,000 emergency housing vouchers financed through the American Rescue Plan. And Maryland received 808 emergency housing vouchers. 569 of those emergency housing vouchers have been leased, and 571 households have been served under this program. There's 191 people with emergency housing vouchers who are looking for a home in Maryland. So, and that information is available on the dashboard. Emergency housing vouchers, we're hearing, are favorable in some ways because they already include the ability for some of the wraparound services. So they can help support the first month's rent, security deposits, and some of those other features that are necessary when helping people obtain and maintain housing. Mainstream vouchers assist non-elderly persons with disabilities. And aside from serving a special population, mainstream vouchers are administered using the same rules as other housing choice vouchers. And funding and financial reporting for mainstream vouchers is separate from the regular tenant-based voucher program. So mainstream vouchers are for the non-elderly persons with disabilities population. And there's also a dashboard that will give you some information on the mainstream vouchers program. Our colleagues at HUD can speak to the vouchers in a lot more detail than we can, but just wanted to introduce these to you today. And then there's housing choice vouchers. And about 49% of the housing choice vouchers in Maryland are leased, and that's based on reporting and the dashboard as it's been updated as of July 2022. And the 12-month attrition rate of people using housing choice vouchers was 6% as of January 31st, 2022. And what I want to mention about the mainstream vouchers and the housing choice vouchers is that when we learned how important that wraparound support is and the value of the emergency housing vouchers, I think we learned that from a call we had with folks in Texas. We took a look at what could possibly be done to try to help support the housing choice vouchers and the mainstream vouchers. And so HUD put out a special request for applications from public housing authorities to apply for administrative support for the housing choice, for the housing vouchers, mainstream and housing choice. And they have awarded many of the public housing authorities that have applied to date with additional administrative support funds by vouchers that have been leased out to enable some of those wraparound supports. And if this is something you're interested in learning more about, we can have our colleagues from HUD maybe join a future call to share that information and go into some more detail about it. But that's an important change that's occurred over the last couple of months. Then care transitions is another area. I think this is another area where Maryland has been excelling. This is transitions, helping people transition out of institutions back into the community. It would include nursing homes, people that might be in state mental hospitals or psychiatric facilities. And then the HUD homelessness continuums of care are another opportunity. HUD publishes this funding opportunity once a year, and they currently, the opportunity recently closed, and they'll be announcing continuums of care at the beginning of the year. But what's important about the continuums of care is they're much like the network lead entities in the community hub concept. They serve people who are homeless or at risk of homelessness, and they look to provide them not only housing, but also the critical services they might need to stay stably housed. And these continuums of care often include a network of organizations really working together to help serve individuals experiencing homelessness. But they're also looking at how they can tap into some of the benefits that people who are experiencing homelessness or are homeless actually have available to them, and how they can get infrastructure in place to like build health plans and other systems that might have some resources supporting those individuals to help them get stably housed. There is a link to the list of the Maryland continuums of care. And if you're engaged in a continuum care, if you could maybe just put that in the chat, that would really be, helpful. Because we're always looking to learn where we've got some partnerships already occurring. House America is an initiative about how we work with city and county leaders to house the homeless. And Baltimore City is a member of House America, and there's 2 calls that happen each month with cities and counties involved in House America. And there's really great stories that are being shared by strategies that are used by cities and counties across the country to really help people who are homeless get housed. And so I encourage you, if you're in a city or county where there isn't a House America partnership, to visit that site and see if that could be something that your leadership might have interest in your county or city. The Maryland State Assistive Technology Act program is another resource that really has information about how to help people with becoming more independent with certain functions that enable stable housing, to modify their homes so they can live within them using assistive technology. So encourage you to get connected to the state AT program, and that link will take you to information on how to find them. And then the Maryland Public Housing Agencies are really a great opportunity and partnership. The public housing authorities administer the voucher program and are really available to help people get connected to housing. So if we move on to the next slide, we're going to go back and have a Menti question. We're interested in learning, like, who are your current housing or housing related partners? So if you can go to Menti, that would be great. And the question should come up on your screen. And we'll put the Menti information in the chat again for those that might have joined late, so you have it to participate in these in the remaining questions. And if you're joining us late, to get into Menti, you put in your browser www.menti.com, and you can use your browser on your phone or your browser on your computer, and then enter the code 49180273. Click on join a presentation, and the Menti question should come up.
And Lori, while you're waiting for some of that data to show up, we do have some other information in the chat. One person was saying, what about senior citizens? She was reading HUD 811, and it was showing persons only up to the age of 62. And another of our colleagues on the phone indicated that they had been involved with Carroll County's continuum of care, but she's recently moved to the Eastern Shore. We're thrilled to have her here. So hopefully she can work some of that same magic on the lower shore.
Thank you so much, Sue. Alicia, do you want to talk about senior housing? I know the HUD 202 programs are options, but Alicia, you might be better positioned to respond to that question.
So once I saw that, I did, Lori, as you said, went straight to the 202 program, and I saw that in 2021, the 22 announcements are just out, and there's an opportunity there for people to apply. But in 2021, Enterprise Community Development did receive funding for Baltimore to build new units for elderly 62 plus. I also do want to make mention of the home modification grant program that's available at HUD. And that's a huge opportunity to really help the needs of older adults in their home. because we understand that such a significant percentage of the existing stock of consist of people who wish to age where they are, and that is in fact homeowners in single family dwellings. And so that's a huge opportunity. And voucher programs are also accessible to the elderly too. So we just want to just make it clear, there's a lot of programs both in PIH as well as in multifamily to support the needs of the elderly. And we do want to speak to the growing percentage of older adults that are experiencing homelessness. And that's something that HHS generally is working with HUD to really, put some strategies forward to address those needs.
Thank you, Alicia. And I also know that the low income tax credits sometimes can be used to help develop affordable housing. And some of the senior living providers tap into some of those programs as they develop housing. And they also could possibly be some partners in your community. Okay, we've got some responses coming in on who are your current housing partners. Okay, we've got the voucher program is closed. Okay, so that's an issue. Local housing and sitting housing authorities. Some of the housing is all private. The Wicomico County Housing Authority is a partner. HUD's a partner. Okay. Thanks for these responses. Let's go on to the next slide. And this is our next question. Over the next 6 to 12 months, what housing related goal do you want to achieve? This will really help us understand how we can target the technical assistance to really support what you're working to achieve. So as you think about your population you're serving, the goals of your organization, the communities, what's a housing related goal you want to achieve within the next year or so? It could be as simple as developing a partnership with a particular group. It might have to do with becoming more aware of certain services that might be out there. And it might have to do with actually, you may have some data that you want to move the needle on around a particular housing needs of the populations you're serving. We're seeing some come up here. Let's see. Reduce the length of time waiting for housing. That's a good one. Clear inventory of available housing, eligibility requirements. Work group to research opportunities to fund affordable older adult housing and service navigation. Better partnerships to be able to refer and get information back. Having vouchers that are specifically for the senior citizens. These are great. Okay, well, we're gonna leave this open maybe a little bit longer, but maybe if we can go back to the slides, I'll tell you a little bit about the Housing and Services Resource Center and some more resources that we have available and partnership opportunities. And I think there was one popping up just a second ago about decreasing wait lists. So Kate, if you can maybe keep that open a little bit longer so people can finish whatever they're responding with. And I mentioned before that the Housing and Services Resource Center is a partnership between HHS, the U.S. Department of Health and Human Services, and the U.S. Department of Housing and Urban Development, or HUD. We do have an email box, which you'll see on this slide, hsrc@acl.hhs.gov. We encourage you to email us if you have any technical assistance needs or questions. We're happy to get you connected with technical assistance providers or federal agencies and departments that might be able to help respond to your questions. And we do have a website. This is one of the initiatives that we launched early on, or one of our products. And this website is at acl.gov/housing and services, all run together. And that website includes, it's a one-stop shop to really support people who help people find housing and obtain housing, and also services that help them stay stably housed. It's a one-stop shop on different resources and information and tools that we have available to help support you on the front lines. So encourage you to visit that if you haven't visited already. And Alicia put a link to the Housing and Services Resource Center in the chat. If we go, the other thing I wanted to mention is that we have webinars periodically. So if we go on to the next slide, and the What's New section includes our a listing of our webinars, and we record those. We have the PowerPoints up, we have transcripts. So we encourage you, if you are interested in a webinar that maybe happened and you weren't able to attend, we do encourage you to view those. Our webinars are highly attended. We have usually thousands of people join to hear about those. We do look to feature, that's why it's helpful to know who has what partnerships or what areas you're working in. We do peer, we hold out champions across the country and do peer teaching and learning. So really encourage you to take a look at those webinars. And also in this slide has a list of some of the most recent webinars and that we've developed, and they really are on a wide range of issues, and we're always looking to learn more about what some of the needs are. So if you have a particular need, please do email us. We also, in July of 2021, published a document that's on the previous slide that you can link to, that highlights some of the different programs that can be used to help support people in obtaining housing and staying stably housed. And so I encourage you to take a look at that. We offer state office hours. We just started doing this in June of 2022, where we'll schedule some time with a particular state to work with them and their disability, aging, health, and housing partners to work through any challenges they might be confronting around helping people access housing or technical assistance needs that they have. And all the partners in the Housing and Services Resource Center, the federal agencies, come to the table to help sort through some of those questions. So if we go on to the next slide, we also publish issue briefs. We want to talk a little bit about the additional resources. We mentioned already the housing voucher dashboards. I encourage you to visit those. You can at the top select Maryland and then get information about how those vouchers are working within your state. And you can actually select a particular public housing authority to get a view on that geographical area and how those vouchers are being distributed. We've got the link for the Housing and Services Resource Center. There is information about care transitions on the ACL Care Transitions website. And then the other two links are to the CMS Money Follows a Person's website and the supplemental services information. If we go on to the next slide. We've got more partnership opportunities. Mentioned House America, the United States Interagency Council on Homelessness. That's a good site to visit if you haven't, if you're working to serve the homeless population. There's really some great resources there. There's transportation partnership opportunities. The Coordinating Council on Access and Mobility has a braiding guide on how you can leverage Older Americans Act or Rehab Act funds that are invested in transportation to match Federal Transit Administration 5310 and 5311 funds, which are about developing transportation programs, community transportation programs in rural areas and in tribal areas. And then there's some additional links to other transportation technical assistance centers that are funded by ACL or FTA. And one of the transportation centers we just launched is the National Transportation Accessibility Center, where we'll be working to build a nationwide network, really working to help communities and states make transportation services more accessible and build in the accessibility features that are needed for people with disabilities. We have a Commit to Connect nationwide network of champions that's about addressing social isolation and loneliness. We do know that some people become unhoused because they're isolated and lonely. And so there's the Commit to Connect initiative and the Engaged Resource Center have programs available that, or could link you to programs available that really help people get connected. And we know MAC is one of our champions in this space with the work that they're doing with PEARLS and the USERS assessment tool. And then we also are working to develop a direct care worker resource center. So when we move on to the next slide, this is another opportunity here to get some more input for you. So as you think about all these opportunities, what housing related partnerships would you like to strengthen or develop? This will help us really hone in on which resources might be most helpful as we continue to support you in your work, and what agencies we'll be working with. And let me look at the chat. I'm seeing that there might be some. Okay, and Wendy's like, we've got 14 minutes left. We probably have a little less than that now, but let's see. I see the slides up and I don't see any responses yet, but if you do have any housing partnerships you'd like to strengthen or develop, be great to hear what they are. Public housing authorities with open waiting lists. Great. HUD. Wonderful. Okay, I'm gonna, Kate, if you can keep that open just so we can get more responses as they come in, but I'm just gonna stop now. I think we really, this was the bulk of our presentation. We have our contact information, Alicia and I. Please feel free to reach out to us. We're here for you, or email the HSRC mailbox. I see some more coming in here, open wait list, connections with MFP and housing. The other thing is we'd be happy to take any other questions if we want to open it up for any additional questions. And we're here. Our next steps, we really think we want to take this information in that we've heard from you today, and then meet again with Leanne and Sue and Wendy and talk about how we can continue to be helpful to you all. We really appreciate all the work you do each day to serve people with disabilities, older adults, and their caregivers. Your work is so critical to people having successful lives. So thank you so much, and we'll take any questions you might have.
I do have a question for you, Lori. We've been working more and more around that money follows the a person community transition from the hospital. And I guess it would be very important to have a clear straw man of what the housing choices are and what programs are out there to help those individuals. Because what we're seeing is a lot of people in the hospital that have been in the hospital 35 plus days because they just don't have anywhere else to go. So knowing those resources is going to be extremely valuable to our teams as we try to roll all this out. So that's specifically what even brought us into this somewhat conversation today with you all from the beginning. So that would be that's what some of our needs are.
Thank you, Leanne. Those are great questions. I think one of the questions too that would be helpful to us, because vouchers could be ways to help people if there's some available. Are there ways people could keep their homes? Like, are people losing their homes when they're in, how many days did you say, 35 days or longer?
35, there's some people that's been in the hospital 35 plus days and longer. And I mean, I think there's two different issues. They may have a home to come back to, but it's not a safe home to come back to. Like say like the bathroom may be on the second floor. So, or they may have been in a rental and they would have lost it because they were gone so long, like who knows. But I think these, as we roll out this money follows the person community transition, as we're even helping out other counties within the state of Maryland, I think it would be really helpful to have a very clean straw man of here's the choices we have and here's the options.
That's really great. And we can maybe have a conversation with our federal partners to see how could we work with you all to create a list like that?
Because that's what's costing the hospital the most money, right? Because the longer they stay in, the more expensive it becomes. So that's why I think it's very important for us to be able to figure this out and have some answers. We're not gonna have all the answers, but
Yeah.
at least have some types of resources in our back pocket.
Absolutely. I'm also thinking of some of the thought leaders or innovators, champions across the country that are sort of working in this space and some of the work they're doing. One strategy is to cultivate a relationship with landlords in particular areas where you might have high concentrations of people that might be transitioning out of hospitals. I know we can't always predict that, but building some relationships with some of the landlords in those communities sometimes helps. And they look favorable. What we've been hearing is that landlords look favorably around housing older people or people with disabilities who are supported by the Disability and Aging Network and the mental health services and substance abuse services, because they know they have service coordination, they were getting services and somebody's checking in on them, to make sure that they're participating in the services, or if services aren't working, work out another plan that works for people. So that's one strategy, but I'm also thinking about our friends up in New York at Montefiore Health Systems who have another strategy that they use to really help people get safely housed.
And like the follow-up meeting to this one, as you're giving us the federal perspective, we're actually bringing on the Maryland folks. So we'll have the state perspective as of the month of November. So we're very excited to hear it from them as well.
Wonderful. That is wonderful. Okay, Leanne, this is a great suggestion.
So, and we really thank you both for joining us today. It's great as we are working as a national hub, and we're trying to bring all new resources across the state as we really try to marry that clinical side and the community side. And I think most of us know, unless we can do that, we're not going to be successful improving the lives of seniors, and that's our goal. So, and the people with disabilities. So we very much we're very much leaning on our health information exchange to be able to put the information in there, as well as the referral and also the bi-directional data sharing. We're also in the process of looking into my Cody to find out what services are actually going on without having to look in many different places. So we're trying to put all those pieces of the puzzle together. So we do want to thank all of our partners across Maryland as we try to really work on the whole patient participant centered.
Kate, can you advance the slide, please? Thank you. And is there anyone from DHC CH on the call? DHCD, I'm sorry. Okay, there'll be a speaker next. One more time, this is the last slide on the deck that I need.
Yeah, and this is just the next meeting is on November 17th from 1 to 2. And this is when we will be bringing on the Maryland Department of Housing and Community Development. There'll be no meeting in December, and we will resume this as of January 19th, where we will focus on caregiving. So again, this was recorded. It was great. It was great information. So we will put this on our Maryland Living Well Center of Excellence website. And thank you, Alicia and Lori, for this great presentation, and all of our partnerships with ACL. They're incredibly important, and also all of our people across the state. We couldn't do all this work together. Okay,
Thanks again. We'll see you next month.
Bye-bye.
Bye.